Hi, my name is Tim Bale and I am co-director of the Milan Institute at Queen Mary University of London. Welcome to another of our series of videos for the lockdown period. Today we're going to be hearing from Dr. Leonardo Martinez-Diaz from the World Resources Institute in Washington, DC. He is going to be talking about how we build resilience, particularly with regard to climate change, into any policies arising from the pandemic. If you enjoyed this video, please do come back for more. Please do share it and please subscribe to our YouTube channel.
Hello, my name is Leonardo Martinez-Diaz. I'm the director of the Sustainable Finance Center at the World Resources Institute in Washington. Today, in this video, I want to talk to you about two crises. On one hand is the COVID-19 pandemic, which we're fighting in countries all around the world. The second crisis is the climate emergency, the existential threat that has continued even as we fight the virus. And for us in the climate community, the question is, can we find spaces, policies and measures that can help us advance the fight against COVID-19, while at the same time helping strengthen communities against the impacts of climate change? In other words, can we work together to build resilience both against pandemics and against things like hurricanes, droughts, heat waves, and sea level rise, the things that we fear most would come from climate change. And we feel that there are a couple of places where this can happen, where we can find some co-benefits in the investments in the COVID response that would have these positive side effects on the efforts to build climate resilience. So we have three lessons that we hope will help. The first is invest in healthcare that addresses both the pandemic and climate change. A good example is investments in healthcare infrastructure that can help us build medical facilities that can sustain impacts of extreme weather, while at the same time continuing to provide service, including in situations like COVID-19. Take, for example, the Georgetown Smart Hospital project in the Caribbean island of St. Vincent and the Grenadines. This is a hospital that has been retrofitted to withstand the kinds of storms that are quite common in the Caribbean and which are unfortunately becoming even more frequent. This allows the hospital to continue to provide service even under extreme weather conditions. Something similar is happening in the United States at the Texas Medical Center in Houston, Texas, where also medical facilities have been retrofitted to continue to provide service even during storms. When Hurricane Harvey hit Houston, that medical facility, that complex of medical facilities, was able to continue working, continuing to provide all of that life-saving service, even as the hurricane raged. These are the kinds of solutions that can help us, again, both on the pandemics and the climate. There's a second lesson that I think is quite important to keep in mind, and that is, can we strengthen the system that provides disaster risk finance? Disaster risk finance is the flow of resources, of money, that can help communities and governments respond to a crisis just before it happens or right during the actual event, and also in the immediate aftermath of the event. The system that is in place includes national reserve funds that governments can tap to respond to a crisis. It includes things called contingent credits, which are basically fast disbursing loans that can be provided by institutions like the World Bank, and insurance products called parametric insurance products, which can be very quick to provide a payout to governments or businesses that require resources to be able to respond to a crisis. Now, this whole system has been put in place primarily for other kinds of events, mostly earthquakes, hurricanes, floods, droughts. But there is no reason why that system cannot also serve governments and communities that need to respond to something like COVID-19. So by strengthening the overall disaster risk finance system, we should be able to also address the need to have more resilient, more pandemic resilient communities. We have a paper recently from the center called devoted to the disaster risk finance pools that serve developing countries. And we, in that paper, provide a few ideas and lessons that can help advance this goal. Finally, third lesson here is to put disaster responsive social safety nets in place. So safety nets are extremely important. These are things like unemployment insurance that can help in a crisis. As you know, during the COVID-19 pandemic, many people are losing jobs, they're losing income. Social safety nets are more important than ever. And in many countries, those play a crucial role in normal times. But can we come up with safety nets that scale up during a pandemic or during a crisis of any kind? Already, for example, in Africa, in the country of Kenya, there is a program called the Hunger Safety Net Program, which in regular times provides cash payments to poor families who are food insecure. During a major drought, that system, which generally provides funding to those families, will scale up. Then the amount of resources available to the system will automatically increase, allowing the safety net system to deliver more cash to those drought-affected areas. Can we apply the same idea to social safety nets elsewhere? So that when we are hit by a major disaster, whether it be climate change induced or something like COVID-19, which is unrelated to climate change, that the safety net has more resources automatically to assist those communities that are hardest hit. These are the kinds of synergies, the kinds of co-benefits that we need to explore as we devote billions of dollars to fighting the virus. And we can do it while at the same time advancing climate resilience. We will leave our cities, our communities, our countries better off.